It is a story of transformation, one that replicates across all the 47 counties in Kenya. When the Kenya Kwanza government assumed office in 2022, President William Ruto committed to transformative leadership through the bottom-up economic transformation agenda, commonly known as the Plan. Right from its inception, the Kenya Kwanza government identified 5 key pillars as the primary drivers of socio-economic transformation. They include agricultural transformation and inclusive growth, micro, small and medium enterprise, MSME economy, housing and settlement, universal healthcare, and digital superhighway and creative economy.
We came to the conclusion that the bottom-up economic model was the most optimal for all our productive sectors.
The rationale behind the bottom-up economic transformation agenda was to adapt a paradigm shift where, as opposed to a top-down approach of planning, we start by seeking the views of the integral stakeholders at the bottom of the economic pyramid on what measures and interventions by way of development they would wish the government to undertake based on opportunities available and informed by comparative advantages in all parts of the country.
Two years on, at the helm of the country's leadership, how does the government's scorecard look like through the lens of Kenyans? What interventions has the government deployed to support the realization of the bottom-up economic transformation agenda? Recognizing that food constitutes 54% of household expenditures in Kenya, the government prioritized reducing the cost of living through agricultural reforms. Two key strategies have been deployed to achieve cost of living reduction: fertilizer subsidy program and improvement of key agricultural value chains.
Remember, before this administration took over, the cost of fertilizer, 50 kilogram bags, was 7,500 Kenya shillings. Now we are talking about 2,000 Kenya shillings, 2,500, which has never happened.
2,500 inakuwa ni rahisi. Hata ukifanyia kazi, shamba unategemea kitu utapata. Maana pale unatumia 5,900 au 6,000, upati chochote. Ukija kuunganisha hiyo pesa uliotumia, unakuta ni hasara tupu.
Hii fertilizer bag moja tulikuwa tunainunua na 2,500, ambayo ni bei mzuri sana juu kila mtu anaweza iafford, na ile ingine iko juu kiasi, juu kama ile unaenda kununua ya kahawa, unaenda unanunua na 4,500, hiyo ni bei iko juu sana, lakini ya serikali imekuwa ni 2,500. So nimeonelea mimi mkulima mdogo, imenisaidia juu nimeweza kununua.
From the time this administration took over, which was the production of maize was 34 million bags, 90 kilogram bags. As we talk now, it has moved to 67 million bags. And we are looking at over 80 million bags going forward. That alone means that if we stop importation of maize, the price of 2 kilogram bag was around 230. But now we are talking about less than an average of 130.
The fertilizer subsidy program involved digital registration of all farmers.
Once it came to the registration part of it, it was very easy for us, because even those people who live far away from here, but they own shambas there. We could only contact them, and once they come, they could come and register. So we were able to cover a good number and a good percentage.
Process ya ilikuwa mzuri sana. Wewe ukisema uko na shamba wakuandike jina yako na waandike shamba yako kiasi yako. Kwa hivyo utapata message kwa simu yako ukiambiwa pata imekuja, uende bag na unaandikiwa ni bagi ngapi na unaendea wapi.
The Smallholder Irrigation Program is a government project that aims to improve the living conditions of rural households.
Mpango yetu kwa miaka 5 ijayo ni kuongeza sehemu ya kuzalisha chakula kupitia kwa irrigation kutoka ekari 1670 mpaka ekari 1.5 million in the next 5 years.
The program supports farmers to use irrigation and not over-rely on rain-fed agriculture.
This maize has been grown using the water for Nyajigi irrigation project. Now the project intends to, improve the lives of our people.
Mimi nilikuwa wa kwanza kuweka hii maji na imenisaidia kwa njia kubwa sana, kwa sababu mimi kwangu imekuwa nimeipiga na mateke, kwa sababu saizi kwangu hakuna kitu ninanunuaga. Kutoka kitunguu, kutoka nini, hata nimekuwa hata wakuuza. Tunakuwa busy kwa sababu ya hii maji. Kwa hivyo sasa imenifanya nikafurahia sana, kwa sababu hii maji isipokuwa kama singekuwa naye singeweza kukua nikiwa busy hivyo. Kwa hivyo sasa nimefurahia, hata serikali yetu mimi naishukuru sana kwa kutusaidia kwa sababu ya huu mradi.
As part of efforts to revive the textile industry and boost cotton farming, the government has distributed 41,889 metric tons of BT cotton seeds to farmers.
Pamba inafaidisha sana kwa maana nilisomesa naye watoto wangu. Tunanunuliwa kwa cash. Yaani hakuna kununua kwa mandeni.
Toka to revive hii kibanda ya cotton, watu wengi wamepata ajira. Watu wengi wamekuwa wakikuja wanajisaidia na wengine wanazidi kuja, tunawapea kazi.
A raft of initiatives have been implemented in the livestock subsector.
We came up with a plan a few years ago, and we are now seeing it to completion, of putting together a leather district, a big area where we just concentrate on leather manufacturing. This park is 85% complete. Actually, in terms of the leather production side, we are almost 100% done, and 2 manufacturing plants are already up, almost 100% done. Last year, we were able to do about 811 million liters of the formerly marketed milk, which is the milk that goes through the processors and is actually processed and found in the shelves of the supermarkets. With that, we've also been able to increase exports from 4.3 billion to about 7-point-something billion. A rise also in exports, and that has been because of our deliberate now export promotion strategy for dairy.
Unaweza kupata mikopo kwa urahisi uweze kutimiza mahitaji yako na ya biashara.
In 2022, the government launched the Hustler Fund to provide affordable credit to Kenyans, especially those at the lower end of the economic pyramid in Kenya.
We have made interest 500 times lower than the average interest rate in the market.
So far, we've reached out to 24.5 million Kenyans where we are today, and we have disbursed 59.5 billion as of today. Of course, then we introduce a mandatory saving component, and this mandatory saving component was to start now giving or mobilizing some sort of financial security to the borrower. So when you borrow, you start building your own financial security. So last year when we were doing the first anniversary, The top Hustler Fund borrower had accessed close to 4.5 million cumulatively. And this top borrower had saved close to 450,000.
The fund has helped the MSMEs and groups to save 9.3 million shillings. The government committed to construction of 200,000 affordable housing units annually.
We've already awarded projects of over 124,000 units across many parts of the country. They are under various stages of construction, and that has been made possible by the funding that we have managed to get. We are collecting just above 6 billion shillings a month towards the construction.
The jobs created through affordable housing increased by 188,256 in 2024.
We usually have around 160 workers per day. We have the masons, the casuals, the electrical people, the plumbers.
Vijana walikuwa hawana kazi, lakini wakati tulianza waliweza kupata kazi. Kuna wale walikuwa wanatumia miadarati, tukaona wameachana nazo na wameanza kufanya kazi hapa.
Huku niko like workers, department ya chuma. Hapo before sikuwa job, so maisha yangu haikuwa sawa. Na tangu niingie kwa hii job, naona niko sawa. Nalipa nyumba, naweza kusomesha watoto, wanakula. Before ilikuwa hard.
The number of affordable housing units under construction or completed increased by 94,128 units in 2024.
The first phase that we began last year, around September, is now getting to completion. So by end of this year, we should start now handing over keys to Kenyans who have really contributed towards this program.
Actually, I want to tell Kenyans that the project is actually existing. A child cannot just be born and start walking immediately. So we are still at the stage of nurturing the child. So let the citizen just be patient. Let them just have hope that we are going to deliver the project. They are ongoing.
The mortgages refinanced have increased to 1,005 mortgages, representing 40% increment since 2022.
The 1.1 trillion out there as loans, you'll find almost 600 billion is going to support the housing project, affordable housing, 600 billion. And you say most of the main loans go for five years. So in essence, every year we are giving around 100 to 150 billion to support the housing agenda.
Between 2022 and 2024, 213 Juakali artisans have received prior learning assessment and recognition by the government.
Kutokana na hii affordable housing imenisaidia sana juu nilikuja nikajiunga na kikundi cha Stirufixture, wanaume wakanisaidia sana, wakanifunza kufunga chuma. Sasa mpaka serikali ikatulipia fees, tukafanya mtihani kutoka kwa NITA na sasa tunangojea certificate.
Tumefaidika na hii mradi juu hata serikali ileta watu wa NITA. Kwa hivyo tutakuwa mtu akienda kuuliza kazi ukiwa na certificate yako ama cheti yako ya kuonyeshana wewe kweli ni mfundi.
The right to health is a fundamental human right guaranteed in the Constitution of Kenya 2010. In guaranteeing the right to health for all, the Kenya Kwanza government has made progress during its first 2 years in office.
The first thing that we did was rolling out the
community health promoters, and this was in collaboration between national government and the county government. Remember, health is a devolved function, and the role of the national government is policy and training. Already, the community health promoters have been able to register 7.8 million households in Kenya, and we are gearing to ensure we have registered 12.5 million households in Kenya. And out of the 6.5 million people screened for diabetes, 126,000 have been referred to a health facility for further assessment. That means 126,000 Kenyans who are living without knowing that they have diabetes or they have signs of diabetes. 4 million Kenyans have been screened for hypertension. And out of that, 318,000 have been referred to a health facility for further screening.
Tunaenda kuangalia wale watu wagonjwa katika kijiji chetu. Alafu kuna wale ambao wanakona shinda ya pressure na sukari. Tunaenda tukiwapima. Pia tuna watoto wadogo ambao tuna monitor wa under 5 tuangalie kama wameenda immunization, na kama hawajaenda tunawafuatilia. Still bado kunao wakongo ambao wana watu wa kuangalia. Huwa tunaenda kuwatembelea, tunaangalia shinda ambao zinawakumba kule manyumbani.
247,000 pregnant women have been identified. 105,000 have been referred to the clinics near them for antenatal care.
Kuna watu wengi walikuwa wanakufia nyumbani. Juu tuliona kama kuna kesi zingine, tunaona wajawazito hawaendi kliniki. Community sasa imesaidika juu tunawasaidia waende kliniki na tunafuatilia vile wanaenda, na ikikaribia wakati wa kujifungua tunahisisha kuwa waende wa hospitali ndio wajifungulie huko.
Every of the community health promoter has a smartphone with her or him, and they have a software, they have an app that they record this information. And once the information is recorded, it comes to my dashboard to see who has been able to visit which household, or how many households they have been able to visit, what they have been referred to. Every of the information is recorded in that. They have a kit.
Sasa tuko na first aid kit na zina kila kitu. Tumejua kufunga, wametupea vitu za kufunga. Tunao mashine ya kupima pressure, kupima kisukari. Tuna pia hata gloves tumepewa sisi ya kujiprotect. Tunaona wale watoto wako huko kwa kijiji wako malnutrited, tuna muwaki ya kuwapima, pia watu wazima pia. Na hii promoter bado imenisaidia sana sababu kuna kitu ambao tunapata kidogo.
Starting 1st October 2024, Kenya experienced the transition from the National Health Insurance Fund to the Social Health Authority in line with the government's plan to achieve universal health coverage.
If you are in an emergency situation, you are involved in an accident or you've got a heart attack, anything which is referred medically as emergency requires urgent attention. It does not require you to pay money. It doesn't require you to book a doctor. An emergency is an emergency, and therefore you are rushed to hospital, you are taken care of, and within 24 hours you have been stabilized, and then the issues of insurance now comes in. The fund also supports those who are in critical conditions and their premiums have been exhausted. And therefore that fund will you'll use those funds to come and offset the difference of your insurance premium paid, what is still due, and you have exhausted your insurance premium.
We had a huge transformation with the shift from the previous government insurance carrier, National Hospital Insurance Fund, to Social Health Authority. And that's a game changer. And what we are seeing is we have seen an increased number of patients who are able to access services immediately, and those services were not available to them even during NHIF.
Prior to transition, I had done my periods with NHIF, and I was worried that the funds will get lost or be locked away. But it transited smoothly because even after I came when it was SHA, I was able to use those funds under SHA. and I registered under SHA, so I can be seen in the SHA system. We were even able to get services without the forms before the forms were here.
Nilijaribu kuingia SHA, haikutiki muda, nikaingia direct na imeingia sawasawa na inanitibu. Ukuwa KU referral, umefika mahali ungeenda India au uende mahali ingine, sababu hakuna chochote, mashini yoyote hatuna.
The government set out to deploy the digital superhighway as a driver of business growth, job creation, and an enabler to the other socio-economic transformation pillars.
We have deployed about 13,000 kilometers in the last 2 years, with over 8,700 kilometers being done by private sector and government doing about 4,200 kilometers. So this is going to enable us stretch the connectivity to our remote locations, move from the county headquarters, sub-county headquarters, to our villages and to every government institution.
The government has installed and operationalized 1,491 Wi-Fi hotspots countrywide.
We're establishing in markets, road stages, and we've made good progress in sustainability and making sure they are more resilient and they are functional.
274 digital hubs have been operationalized countrywide, through which 16,804 digital devices have been distributed. The number of youths being employed through the Ajira and Jitume Digital Jobs Program has increased by 122,711 from 30,000 in 2022 to 152,711 in 2024.
I appreciate Jitume Lab because I'm able to use the devices here and the internet for free. Mostly I do affiliate marketing. Again, I also use Free Cash app where I earn money playing games, doing offers, downloading apps, but at least I make something and I'm grateful. I get to get things that most of the girls my age don't have.
In the last 2 months, I was able to explain to my partner how I can earn through online. I believe I could be paying fee for myself.
The number of youths receiving training in digital literacy to prepare them for online work has increased from 73,948 in 2022 to 516,505 in 2024.
I believe the government is on the right track in regards to empowering the youth in light of digitally enabled work. The kind of programs offered are basically training on digitally enabled work, and this cuts across several aspects of artificial intelligence. We have transcription, we have web design, we have forex market analysis. So we have students being trained in all those aspects.
We are aware that we have got an ambitious plan, but also realistic and attainable plan. And we need to strengthen our performance and delivery management mechanisms to ensure that we get results. We want to ensure that everybody, each and everyone in the public service, will be held accountable for performance by way of results.
How then is the government safeguarding the gains made so far while ensuring full implementation of the plan?
The performance contracts for the current financial year will inform the basis of the performance appraisal as at the end of the financial year, which will be 30th June 2025. The performance contracts have got very, very clear interventions, clear responsibility centers, clear timelines within which ministerial programs and activities should be undertaken, clear expected outputs and output indicators, plus time-bound targets on the basis of which individuals within ministries, departments, and agencies will be held to account.
To accelerate the momentum of realizing the remaining part of the bottom-up economic transformation agenda, President William Ruto calls for unity of all Kenyans and service for all Kenyans.
we have what it takes to transform the Republic of Kenya. And I am committed to making sure that whatever it takes, whatever decisions that have to be made, we will make them so that our nation can truly be transformed.